Circulation assessment. After reviewing the breathing of the patient, you will assess their circulation to understand how well their blood is being perfused. Look for visual clues such as the patient's pallor, if they are sweating, suffering with cyanosis, or have a mottled look. You can also check the patient's peripheries for temperature by feeling their hands, feet, and legs. Cold, clammy extremities may indicate a lack of perfusion.
I'm going to assess your skin pallor for any irregularities such as paleness, sweating, and the blue or mottled look. Right? I can see that your skin is pink and it's well perfused. Now I'm going to go on to check your hands and your feet and check their temperature. Would it be fine if I touch your hands? Okay. Thank you. And can I expose your legs for a minute? I'm going to touch it and check for temperature. Right, Mona? Your hands and your feet are nice and warm, which is good.
You will also need to perform the capillary refill test as part of your circulation assessment to see how quickly blood returns to the nail bed after you apply pressure to it. You will need to ask permission from the patient for which finger they're happy for you to use. If the finger is on the side of the bed that is opposite to you, it is better to go around the bed rather than lean over the patient. When assessing capillary refill, you need to perform it on a finger that does not have nail varnish or a fake nail on it. You should also assess environmental factors such as whether the patient feels warm and has colour in their cheeks. Apply a small amount of pressure to the nail bed for 5 seconds to see how quickly blood flow returns to it after you've released it. If the blood flow returns in less than 2 seconds, this is a good sign for the blood oxygen levels. If the capillary refill does not look good, you could try another finger. If it is still poor, you could verbalize that you would use an ear probe to gain a more accurate reading of capillary refill. And if this was poor, then you would escalate to the responsible doctor.
Now I'm going to continue by checking your capillary refill. I'm going to do that by pinching or applying a gentle pressure in your index finger. Would it be fine if I use this index finger? Yeah. Right?
I will apply a gentle pressure in the nail bed and release it, and wait and see how long it will take for the blood to come back. I'll also check for any signs of cyanosis, fake nails, or varnishes, and make sure it is warm to touch but not clammy.
So the color went back before 2 seconds, which is good, normal.
Taking the patient's pulse is a vital part of your circulation assessment, and therefore you should palpate the patient's pulse for a full minute, feeling for rhythm, rate, regularity, and depth. In the OSCE, the pulse that is taken is always the radial wrist pulse because it is the most accessible. Remember to tell the patient what you're about to do to gain their consent and ensure they are in the correct position for their pulse to be taken.
Okay, so Christine, I just want to assess your pulse rate now.
I need your arm to be supported in a 90-degree angle for me to palpate your artery and on the groove of your wrist so I can measure your rhythm, rate, and amplitude of your pulse.
Ideally, in the OSCE, you would use a pillow to support the patient's arm. Again, you must gain consent for this.
So I need you to have a 90-degree support angle. So do you have anything that can support your arms right now?
Yes, I've got a cushion here.
Okay, so I would like to use your left wrist for
Yeah.
that one. Yeah, so we can just do it like that.
If the patient did not allow you to take a pillow in the OSCE, you would verbalize to the examiner that this is not the ideal situation and ask them if you can proceed. They would usually say yes, given the time constraints of the OSCE, given you have acknowledged it is not the best practice to take observations when the arm is not supported. When taking the pulse, take note of whether the pulse is weak or strong, thready or pulsating, or irregular. The pulse rhythm is a helpful indicator of circulation. You should tell the patient what their pulse rate is.
I need 1 minute of your time with this one, and I'm going to palpate your left wrist. So there is the radial artery actually, and I want you to remain quiet and calm for me to concentrate in doing it. Is that all right?
Yeah, that's fine.
Okay, so time starts at 8:33. Okay, so Christine, I have checked that your pulse rate is actually 90 beats per minute, and this is actually within normal range, although it's slightly elevated, okay? So I need to write it down again in your news to chart.
Blood pressure is another key indicator of circulation. Low blood pressure can be an indicator of poor circulation. Before taking blood pressure, you'll need to explain the procedure to the patient and also check that the arm you are going to use is suitable. You need to check that the arm doesn't have a cannula. There hasn't been any recent surgeries, inflammation, or trauma on the arm. The patient isn't suffering with lymphedema or arteriovenous fistula. It's good practice to ask if they have an arm preference for you to take their blood pressure.
Now, I'm going to continue by taking your heart rate and your blood pressure. But before that, let me just check if our legs are uncrossed. So this might affect the reading sometimes, right? So we'll first do your heart rate, and can I use your left wrist?
Yeah.
Okay, thank you. I'm gonna check for the rate, rhythm, and amplitude of your heart rate, okay? Or your pulse. Now I'm gonna be quiet for a minute or so. I want you to keep calm and relax, right?
If the patient had any tight clothing on, this would need to be removed at this point. If you roll up the patient's sleeve, you should ask permission before doing this. The arm should be supported at heart level with the palm of the hand pointed upwards. You may need to put a pillow under the patient's arm to achieve this. Remember to ask the patient's permission for use of their pillows for this. The patient's legs should be uncrossed at this point. When checking that the blood pressure cuff is the correct size for the patient, the bladder length of the cuff, which is the part of the cuff that will be inflated, should cover 80 to 100% of the patient's arm circumference. The width of the cuff should be about 40% of the arm circumference. The bottom end of the cuff should be ½ an inch or 2 fingers above the elbow. The cuff should fit firmly but not be too tight.
Now, assessor, I can confirm that I'm using the right size of cuff for Mona. Okay, and I'm gonna put this around Mona's arm, making sure that it's not too tight and not too loose. Yeah, Mona, you'll feel a little tightness, which is normal. That would get the blood pressure of it, okay?
Once you have your reading on the machine, replace the patient's clothes and ensure you document all your findings. Be sure to tell your patient whether or not their reading is in the normal range.
Alright, your blood pressure is 141/73. Do you have is it a normal reading for you?
Yeah, I think it's usually on that.
Okay.
Record your blood pressure reading by entering the top measurement on the scale and the bottom measurement on the scale and connecting them with a straight line with opposing arrow ends. As there are different types of BP machine, you should ensure that you are familiar with the BP machine at the OSCE Center prior to starting the test during your orientation. Often there are pictures of their equipment in the preparation materials. As dehydration can cause low blood pressure, confusion, rapid breathing, and rapid heartbeat, you may want to consider fluid balance and urine output as part of your circulation assessment also. If the patient's blood pressure is low, ask them how much they've had to drink today and/or look at their fluid balance chart if it is present to help inform your assessment.